laser fluorescence.
Laser fluorescence. Using a laser to detect bacterial byproducts.
Very promising, non-invasive early detection.
And digital imaging systems.
Analyzing images of the teeth to identify decay.
It's amazing how technology is advancing.
It is. Caries detection is becoming more and more sophisticated.
Now, let's talk about tooth isolation.
A clean, dry, and controlled working field.
Essential for patient protection, visibility, and quality work.
And our primary method is, of course, the rubber dam.
The rubber dam, a faithful companion in operative dentistry.
Isolates the teeth, prevents contamination, improves visibility.
And protects the patient from aspiration.
Absolutely.
We've talked about rubber dam application, but let's reiterate the importance of clamp selection and placement.
Choosing the right clamp is crucial for a secure and stable fit.
And placement is key to avoid impinging on the gingiva.
Exactly. And once the dam is in place, make sure it's properly inverted around the necks of the teeth. Use floss ligatures for added stability.
Now, what about those cases where a rubber dam isn't feasible?
We have alternatives. Cotton rolls, dry angles, saliva ejectors.
Not as effective, but they can be helpful in certain situations.
Absolutely.
Now, let's talk about gingival retraction.
Providing access to those subgingival areas.
For accurate impressions, proper restorations, and optimal aesthetics.
We have mechanical, chemical, and surgical techniques.
Mechanical retraction, using retraction cords, wedges, or matrices.
Physically pushing the gingiva away.
Chemical retraction, using astringents, vasoconstrictors, or hemostatic agents.
Shrinking the gingival tissues.
And surgical retraction.
Removing a small amount of tissue.
Now let's talk about retraction cord placement.
A technique that requires precision.
We select the appropriate size and type of cord.
Braided or non-braided, various sizes.
Consider the chemical we'll be using.
Some chemicals can cause the cord to expand.
We insert the cord gently using a cord packer.
Starting at the distal line angle, working our way around.
Avoiding overpacking.
Leave it in place for 5 to 10 minutes.
Then gently remove it.
Minimize trauma to the gingiva.
Now let's talk about soft tissue and supporting structure protection.
Minimizing trauma, promoting healing, ensuring long-term success.
So how do we protect those tissues?
Proper isolation techniques.
Rubber dam, our MVP.
Gentle retraction techniques.
Sharp instruments.
Appropriate irrigation techniques.
High volume suction.
Careful handpiece technique.
Protective barriers.
Patient education on oral hygiene.
Close monitoring during and after procedures.
It's all about minimizing trauma and promoting healing.
Now, I think it's important to talk about contact points. As a senior dental physician, those tiny little details can really make a big difference in the long run.
They really can. And, contact points are often overlooked, but they play such a crucial role in maintaining the health and stability of the dentition.
Okay, so break it down for me. What makes a good contact point, and what happens when things go wrong?
Well, a good contact point, think of it as the guardian of the interproximal space. It prevents food impaction, allows for natural self-cleansing, helps keep the gingival tissues healthy.
So we want that contact to be not too tight, not too loose, kind of that Goldilocks situation again.
Exactly. And the location and shape of that contact point, well, it varies depending on whether we're talking about anterior or posterior teeth.
Right, because the anatomy is different.
Exactly. So in posterior teeth, that contact point, we want it closer to the facial surface.
Okay.
This creates a larger lingual embrasure, which helps to direct food towards the lingual side.
Makes sense.
Now, anterior teeth are a bit different. That contact point, we want it closer to the lingual surface.
Okay.
This creates a larger facial embrasure, which is more aesthetically pleasing.
So it's all about function and aesthetics.
It is.
Now, what happens when we have improper contact points? What kind of problems can arise?
Oh, all sorts of problems.
Yeah.
If the contact is too broad, well, it becomes a food trap. You get plaque accumulation, periodontal issues. If it's too narrow, it can act like a wedge.
Okay.
Force food into the interproximal space. That leads to discomfort, inflammation, and if the contact point is missing altogether, well, then you can see tooth migration.
Wow. So it's really important to get those contact points right.
It is. It's one of those little details that can have a big impact.
Now, speaking of details, let's talk about tooth numbering systems. I mean, we use these all the time, but it's always good to have a refresher.
Absolutely. It's the language of dentistry.
Right. So we've got the universal numbering system. That's the one most of us are familiar with. Each tooth gets a unique number from 1 to 32.
Right. And then there's the Palmer notation method, which uses a quadrant-based approach.
Right, with numbers and symbols to indicate each tooth.
And then internationally, there's the FDI system, which uses a two-digit code.
Okay, so different systems for different purposes.
Exactly. But regardless of which system you use, it's important to be consistent and accurate.
Absolutely. Clear communication is key.
Well, I think we've covered a lot of ground in this deep dive.
We have. We've explored the ins and outs of moisture control, pain management, soft tissue protection, sterilization, even those little details like contact points and tooth numbering systems.
It's been a comprehensive overview of those preliminary considerations that are so crucial for successful operative dentistry.
Absolutely has.
And, as we wrap up here, I just want to emphasize the importance of continuous learning in our profession.
Absolutely. Dentistry is constantly evolving. New materials, new techniques, new technologies. It's up to us to stay informed and to keep refining our skills.
Exactly, because at the end of the day, it's all about providing the best possible care for our patients.
I couldn't agree more. It's a privilege to be a part of this profession.
Well said. Well, I think that's a wrap for this deep dive.
It's been a pleasure.
Until next time, keep those handpieces spinning.